That's the fun of it sometimes, not knowing what you're going to be getting into, the unpredictability. All right, so today we're starting our day with a case that's going to probably seem a little simple when we take a look at it. You know, obviously with 27 years of experience, we make it look a little bit easy. She's already had implants somewhere else with a breast lift, and she wants to change her size from this, what she currently has, to a little bit bigger. Now, the procedure itself is simple. What might look really simple and easy during the procedure actually took a lot of planning. We sat down, talked to her about her expectations, used 3D imaging, the before and after imaging, so that we could see what she might like, because she's very athletic. And yes, we want to add volume, but we don't want to get her to the point where she's having to put 2 sports bras on to support herself during her activities. So we're trying to strike that balance. So here's our patient. This is the implant she currently has in there, and she had a breast lift somewhere else. She's athletic. You can see she's athletic, but she's just always desired a little bit more volume. Give her a little bit more fullness, a little bit more cleavage here. And so when she came to talk to me, you know, she wants that fullness, she wants to be bigger, but she also wants to be able to maintain her athleticism and not have a negative impact even on the clothes that she wears and how she puts on her sports bras. So again, we spend a lot of time trying to figure out, you know, what size she would want to do. Technology really helped a lot. The before and after 3D imaging helped. So we came up with this, which is a 580 implant. It's the narrowest 580 that we have here. And so we're actually going to use this small incision. She already has a breast lift incision from another doctor. So we're just going to use like about 1.5 inches of her lower incision. I'm going to take this implant out, check it, make sure it's okay, but we're going to have to expand the space so we can accommodate the new implant, and it's going to fit within this space. She's probably going to gain a cup and a half with this exchange and get that fullness. We're really going to try to avoid the implant coming out to the side. We want it here. So even though it may appear like this is a simple procedure, there is a lot of planning before, and then we got to make sure that we execute the plan here so that we don't have the implant falling to the side. We actually get the cleavage and the fullness in the place that we want it to be. All right, here we go. Let's see what we got in here. We have an idea it might be like a 250cc implant, but we're going to find out. So it's a 250S RLP. That's the implant there. So we're going to replace that with a little bit more volume. Now you can see the difference in the volume. This is her without the implant. This is with the implant. So now I've got to go in and I've got to create the space to accept the bigger implant. So we're going to create that more along here and try to keep that intact so the implant doesn't shift to the side. Here's our new bigger implant. There's the smaller implant. Now we're going to put this implant in there so you can see the difference between the two. A little bit more volume, a little bit more projection. So we're going to see how that fits inside. So there we go with the funnel. Okay. There we go. 1, 2, 3. Looks pretty good. Looks pretty good. Here's the old implant. Here's the new implant. You can see the cleavage and the fullness. I need to make a few little adjustments down here, but other than that, she's going to get the fullness that she wants. So in this case, she had her implant underneath the muscle. She likes to work out. She likes to do more strength training than cardio. Most women will be putting the implant underneath the muscle, but in those women who like to do chest exercises or they're in competition when they get their body fat percentage down to single digits, we really have to have a big talk about, do we want to put the implant underneath the muscle? Underneath the muscle gives you a little bit more coverage, but if you're somebody that works out your chest, does push-ups and bench presses, the implant could move as you move that muscle, so then there could be talk about putting it over the muscle. So it's a big conversation that we have to have with some of our patients, but in her case, her implant's already underneath the muscle, so it was just easier to keep it there, and she was happy with where it was before anyway. All right, so this is the halftime show. So this implant was in here, so it looked more like this. This still has the old implant. This is a new implant in here, and you can see the fullness, you can see the roundness. Looks really good. We got the cleavage and the upper pole fullness. We found a rupture on this side, and she really wasn't having any symptoms, and that's why it's good to be getting your implants monitored at least every 2 or 3 years. And so the good thing is we're so used to this. We already have a system, so we're putting into place right now. This is probably more a recent rupture, so she hasn't gotten the consequences of having a long-term rupture, which is breast contracture, which is hardening of the breast implant, constant pain, shifting of the implant. She hasn't experienced any of that. So once we clean everything out, we're just gonna do the same thing we did on the other side. We're just gonna remove and replace it and get a very good result anyway. You'll see that at the end of the procedure. It's all kind of connected, so we can get it all out. You're gonna see we can actually put that right there. I'm just gonna grab onto the shell here. Kind of a small. This could help me get it out. Let me just get it out here. The last one was a little easier, but get it. There we go. Got another one. As much of that out as possible. We'll put that all right there. All right, so here we are. We've got the 2 new implants in there. Remember, she had this smaller little pancake implant in there. We put the bigger ones in there. It was ruptured, but we cleaned it out, and so we still got the same result without a big fire drill. We just did what we need to do, employed our systems, got it all taken care of, and now she's got a great result.